erectile dysfunction, which is inability to achieve erection, and there is another one is inability to maintain that erection. The most conditions are like premature ejaculation and male infertility. When a person is using too much smoke, a chain smoker, or using lot of alcohol, a regular drinker you can say. Depression, diabetes, obesity, weakness in your nervous system, or in your married life, all these different conditions can leave many other issues in your life. How to know that I am suffering with this problem? Usually what happens early morning, means they feel erection. 30-minute walks at least, it reduces your erectile dysfunction by 41%.
A very warm welcome. Thank you so much for tuning in. You're just in time to catch us here on 3T TV, Thika's #1 online news channel, where we are telling the Thika story as it is. My name is Juliet Muthoni, and today I'm bringing you yet another informative health segment, and we are shooting it on location at the Thika Gymkhana, which is a wonderful location that is located within Thika town, that is the heart of Thika, which is section 9. At Gymkhana, they have a swimming pool, they have grounds, they have a gym, which even non-members can use at a fee. Their kitchen is even up for hire if you have a function, a wedding reception, a graduation party, or even a pool party. You can talk to them as a non-member for a fee and hire it out. Be sure to check them out. So today, like I have told you, I'm bringing you the health segment, and we've had several men come to our inbox with concerns about male sexual dysfunction, and we have our resident doctor who is going to break it down for us so that we can help somebody who is out there. I hope that by the end of this segment, if you haven't subscribed, I'll have given you a good reason enough to. So let us dive right into it. How are you doing, Doc?
I am good. How are you?
I'm all right. Thank you so much for finding time. We had a very good session last time, and I know this time around it will be the same. Before we go any further, kindly introduce yourself.
Okay, Namaste. Myself, Dr. Neha Bhatt, from Indian Ayurvedic Alternative and Holistic Science Therapist from an Health and Wellness Center, Thika.
Thank you very much. Now, male sexual dysfunction is a concern that we've had. There are several men that have come to our inbox asking about how they can go about correcting that. Kindly start us off.
Sexual health related problems have become more and more these days. So people are neither physically fit or even not in a mental peace. So sexual health encompasses physical health, mental health, emotional health, as well as social health. So in related to sexuality, issues arising is factors to all candidates about the health, which is related to any issue related to reproductive system, or fertility related problem, gynec problem, or low libido or sexual dysfunction, and many more. So it is very crucial to take a time for yourself and for your partner also to think about these factors, why this is happening these days. And it is, you can see, 1/3 of people, 1/3 of men actually, they are suffering from sexual dysfunction. This is what is happening in society. Let me start with what is erectile dysfunction. It is a condition when a man finds problem or difficulty in having an erection, or in a today's condition, because of the hectic life, stress and sedentary life, this problem arises. You can always say like the hardness of the penis is required for the sexual intercourse. It is not there. That is called erectile dysfunction. And basically they are of two types, which is inability to achieve erection, and there is another one is inability to maintain that erection.
You had mentioned that there are three, there's physical, mental, and the emotional part of it is also.
And also social.
And also social.
Yeah.
Kindly probably elaborate a little bit about that.
It's because, you know, our day-to-day life, the way, the issue we are facing it, the stress of work, the stress in relation, and basically the stress in relation is because of we are not talking about this. We are not giving time to our partner. We are not looking for the solutions. Sometimes ladies, they think like, oh, he is not able to perform, but it is not like that. Sometimes they have more workload problem, they have some, in fact, even kind of disease. It plays a big role in it. So all this includes like maybe he is not physically fit, he is suffering from some problem, sometime even socially, you know, relations with others also, you are not able to assemble them nicely, and mentally also you are not stable, you have lot of responsibilities. So no, all this reasons it matters in this case.
So it boils down that we should just be patient and kind with each other.
And you have to give yourself time, you have to give your partner time, you have to sit together, you have to talk together. Even on my last interview I have said that for making a good and strong relation, not only sexual relation is important, also you need to understand each other is very important. And for that you have to give yourself time, you have to give your partner time. Before it was like 7 to 8 hours job, but these days like even 12 hours, so you don't have time. You feel when you are coming back to home from work, you feel more tired, yeah, but still you have your weekends, and you know, where's a will, there's a way.
Sure.
Yeah, so you have to work on it, you have to have time for yourself, whether you choose weekend, whether sometimes even a good nature walk, sometimes go and stay with nature, connect with nature, it also helps. You have to relax your mind, yeah, that also helps in this. So for that happy living life, you need to work yourself. No one else will give you this,
Sure.
yeah, so you have to work for yourself, you have to give time to your family, you have to give time to your partner also to talk about these things, to sit with them, yeah. So these are the conditions, you need to actually work on it.
Okay, now going back to male sexual dysfunction, what are the most common conditions?
Okay, the most conditions are like premature ejaculation and erectile dysfunction and male infertility. In the first part where it is premature, you can say during intercourse, the fast semen discharge, it is a premature ejaculation. Also the reason is dysfunction from either side, maybe it is a male or even female. Sometimes what happen, one partner feels it's premature, it discharge very fast. So that is also the reason, and scientific reason is when it is less than 1 minute, that is when you call it premature.
Oh, when it is less than 1
less
minute.
than 1 minute, that is a scientifically. So that's when you call it, it's premature. And there are so many other reasons also which affects this thing. And when we come to the erectile dysfunction, it is like during the intercourse, there is no proper erection, and sometimes erection is very less than a normal, and sometimes not at all, even that happen, that person has not at all erection. So that is also the reason, especially people with the hypertension, diabetic, uh, high blood pressure patient, those patient they face this kind of problems. And once it comes to the male infertility, that is when you are a couple keep on trying for a kid and it is not happening. You know, you are trying so many things, you are going to the medical help, you are trying other ways, but it is not happening, you are not able to conceive. And that's when the factor of 60% it also responsible, that is a male infertility. It's not only depends on the female, it also male.
Okay.
Yeah. So that is when you call it, it's a male infertility factor.
So it could be the male, it's not
60%, according to one survey, it has come that 60% it depends of male infertility also. Yeah, where the semen counts are very low. So when a man sexually assaulted or excited, and the penis, what happened that time is the penis blood circulation is there double like 300%, and that's when they feel erection, actual erection. So that is also the reason why they don't feel that erection dysfunction. Yeah, and when they are feeling when the blood circulation was 300% more than the regular, and if there is any problem in that blood circulation, that's when they are not able to, you know, erectile properly. And another reason is if the nerves erection, you know, the nerves they control the erection also, and if the nerves has problem, they regulate all this circulation of blood surround that area. So that nerve has some problem, or that nerve has some blockages, blood blockages, then also they feel this erection problem. Also the big factor is hypothalamus, which is a part of brain. If somehow your hypothalamus is not working properly, it has some problem, it is disturbed maybe, so then also men find this problem of erection. Also medical, when we are seeking too much of medical help, you are taking lot of medicines, like you are already taking medicine for diabetes, you are taking for hypertension, which is high blood pressure, sometimes psychological, you are taking for your psychological problems, you are taking medicines, that's also lead to this problem. And very important factor is when a person is having is using too much smoke, chain smoker, or using lot of alcohol, a regular drinker you can say, yeah, consuming lot of smoking or alcohol also, it's the biggest factor for these days life, for today's life. And also there is a physiogenetic erectile dysfunction, which you call, it is a kind of dramatical erection. It happens when maybe when you have done this sexual intercourse with your partner first time, and maybe due to some many reasons you would not be able to perform nice on that day. And then when you are going to the next time or third or fourth time with your partner and you are not able to perform, but in somewhere in your mind you have that guilty, you have that thinking that, oh, last time I was not able to perform and there was something wrong, the erection was not there, it was early discharge, so many problems, you know. So actually your mind is not there that time. Neither you are able to satisfy your partner, neither you are able to enjoy that moment. So that drama of your mind, you're not fully at present at that moment. So that's when also this problem arises. So that is when you call it psychogenic erectile function. So this is also a biggest problem. Usually what happens then when you're not able to perform second time, third time, fourth time maybe with your partner. So lady thinks that you are not able to perform. Your partner thinks that you are not able to perform, you are not able to, you know, satisfy her. But this is not also the problem. This is not always a matter. It matters because your mind was not there. You were thinking something else in your mind that moment. So that is the thing. If you are calm, you know, calm in your mind and you want to enjoy that thing, you have to be present from your mind, body and everything there, then only the erection will come nicely. So this is also happen. And another thing is, when your anxiety, when you are not calm, you cannot eject at all. That is the also important reason. Depression, diabetes, obesity, weakness in your nervous system, all these different conditions can leave many other issues in your life, like stress. Of course, because of that you are stressful, you are not able to put your 100%, and also it's a low self-esteem also, because at that point you think within you that why you are not able to perform, what is the problem. That also spoils your life, your personal life, your self-esteem also.
Please tell us how we can overcome.
You have already mentioned natural life. So that's where I'm coming to. Of course, we have to live a natural life. We have to connect with the nature. Our so many bad habits, we have to stop now and now. And usually it has seen by a survey, a person age from 30 to 40 and you are not able to perform your sexual relation nicely, you are not good at bad and you are taking it easy, you are not seeking any help, you are not working on yourself, it also causes heart problems. As I have already mentioned before, the veins, the circulation of blood, it all comes from the circulation of blood. Blood circulation is not there and you are not seeking it seriously, you are not taking it seriously, you are not working on it, you are just taking it, it's okay. You are very soon you are going to come to the stage where you are feel your heart problems. So this is a alert point actually. And yeah, how to know that I'm suffering with this problem. Usually what happens early morning, men's they feel erection, the penis gets tight, yeah. So if you're feeling you're not having that symptoms, so you have to be alert, you have to think that there is something wrong going on in your body, so you have to work on it. That is the time your body gives you a chance to understand, and that is when you can understand there is something wrong going on in your body and you have to work on it. So the different ways we are talking about to overcome it, of course in our therapies, in our natural therapies, neurotherapy where I say, we have advanced genetic formula. By using of that you can get rid of this kind of problem. And also sometimes it also happens that kind of injury, you have passed some kind of injury, so you are suffering from this problem. For that also we have our injury treatment and advanced genetic treatment we give to our patient, and you will be okay in few times. And next part, on the nature part, if I talk, it is walking. Walking is again, even last time I have mentioned for the ladies, now this time it's for the men's. It's not like only ladies have to work for themselves, also men's. Walking 30-minute walk. 30-minute walks at least, it reduces your erectile dysfunction by 41%. So at least if you are not able to walk 1 hour, at least 30 minutes walk is very important to provide blood circulation, to strengthen your muscle and overall. So this is also very important. And there are some yoga poses also. In yoga we have some asanas which you call is Adho Mukha Sarvasana. It is called Adho Mukha Sarvasana. You can always Google it and you can get the pose. There is another one which is called Malasana and Setu Bandh Asana. Malasana, Setu Bandh Asana, Adho Mukha Sarvasana and Matsya Asana also. These are the yoga poses. If you practice for like, you can start from 15 to 20 minutes every day regularly. This is also to provide a better blood circulation, surround your pelvic muscles and your thighs and down to your navel. This asanas you can always Google on. What happens sometimes, because of lack of knowledge or you can say even here lack of time also, you are not able to do this asanas, yoga practice, yeah. So the better way is you can do walk every day. I highly recommend it. I highly recommend walk at least 30 minutes, and you can also use the pelvic floor muscles exercise, because walking is also relieving your stress. You are also getting a fresh air, which is good for your oxygen level also, yeah. So this practice is very important if you are not able to do any other practice. After that, if we go to the food, dietary remedies,
yes.
now here we are coming to the nature. So how you can control it, how you can reverse it with the food help, with the help of food. I would not say diet, because diet means you are restricting yourself to eating something. No, it is not like that. Here we are going to connect with the food. We want something healthy, which is healthy and natural food to include in your day-to-day diet. So drumsticks is the best example for it.
Drumsticks, not chicken, moringa.
No, it's moringa, no chicken. I don't advise for any non-veg. You have to connect with nature. So it's drumsticks, moringa. You can use even leaves, even flowers. They are equally nutritious, equally healthy, lot of minerals. It has possesses aphrodisiac in it, property in it, which helps to improve the libido also and the blood circulation also, and it also improves the testosterone level, which is a hormone, yeah.
Okay.
So it also helps to improve the testosterone level.
Okay.
So by using moringa, you can actually reverse this problem. And there is also a Ayurvedic powder called ashwagandha. This ashwagandha, most of people they don't know, because this is Ayurvedic remedy. So what you can do is, from any Ayurvedic shop you can buy this powder, and every night you just have to use a half of spoon and mix with the warm milk, and you have to drink it out.
Okay.
So ashwagandha also, it has aphrodisiac property in it, which helps to improve the sexual strength and erectile function, and also it gives a better blood circulation to your pelvic muscles also. Okay. Now another one is a spinach. Spinach is easily available everywhere. Spinach is a good source of folic acid. Folic acid is a vitamin, you know, B12, folic acid, thiamine, niacin. These are the important vitamins which we needed. So spinach is a natural source where we are going to get this folic acid vitamin from. You don't have to take any other substitutes or vitamin capsules, no. So the spinach has this is, and also spinach has a blood flow booster. Spinach is very good blood flow booster. Our previous videos, we have used that green juice, you remember?
Yes.
The immunity booster, that you can always use that drink also. That juice also we have included spinach, if you remember, yeah. So that is also going to help you naturally without taking any medicine, and I have mentioned already, medicines also bringing you to this problem. So stop taking unnecessary medicines. Also almond is a very good source of it. Almond is a rich source of vitamin E, and it's a natural source, yeah. So it's a storehouse of healthy vitamins, fats and minerals in it. So good for a tremendous energy, you need it. Same thing, you need almond powder, and every night half spoon of powder mix with warm milk, and you can have it. In case if someone is complaining that he is allergic to almond or highly acidic maybe, so doctor said you are not supposed to take this thing. So what you can do is, you can always soak almond for few hours and you can chew it very nicely. That is also a rich source of vitamin A and a storehouse of healthy and beneficial fat and all these things. Yeah. Apart from that, in your diet you have to include fresh fruits and vegetables. Fruits which are fresh, not which are stored. Any fruits which are available in that present season, you are supposed to eat those fruits. Any vegetable, those are not stored, not dried. At the present, whatever vegetable you can use, you supposed to add in your diet. And this is all natural remedies which is going to help you to reverse this problem and to overcome with this problem.
Wow, quite insightful. A question I'd like to ask. You've said about mixing the powder with milk. Can you use water, warm water instead?
No. Milk has that property which is going to help you for the nutrition to absorb and to get the healthy overcome of these problems.
So you recommend milk?
Recommend milk. If you are allergic to milk, you can always use coconut milk. There is a way you can make coconut milk also.
Yes.
But I would not recommend soya milk. Soya milk is already heavy to digest. So either you can use almond milk or a coconut milk. That's the option.
Okay. Wow. That was quite a lot to digest, but I like the way that you have broken it down. Now, I think you have basically covered everything.
Yeah, I think we have covered everything which is people wanted to know, which is important to know. Yeah.
Yeah. So as we conclude, probably you have a last word, and most definitely give us your contacts. There's somebody who's probably suffering in silence and they would like you to assist them.
Good question. I don't know why we are suffering in silence. I wanted to ask you one question. If you are suffering with common cold, if you are suffering with any disorder in your body, do you go to doctor?
Yeah, when you're sick, you go to the doctor.
Yeah?
Yes.
Or doctor comes to your house?
No, you go to the doctor.
And are you the one, you explain to him what is the problem?
Yes.
Or he knows from somewhere?
No, you have
He has that sixth sense to know what the problem is.
No, you have to go and explain your symptoms.
So do you feel shame going at that time when you are suffering from fever or common cold or neck pain, cervical, do you feel problem?
No.
Why?
Because you have to be vulnerable so that you can get assistance.
Yes, because you feel that is a part of your body, that is a part of your life, yeah. You cannot stay without it. If your digestion is not good, you are suffering from constipation, you feel like you need to get rid of constipation so that you can live healthy life, isn't it?
Yes.
So why the private parts? Why the reproductive system? Why we doesn't want to talk? For that also there is a specialization doctors there, isn't it? Okay, one I can say reason I can see is ego. Sometimes we feel it's ego. No, we are always perfect. We are perfect. Or maybe we doesn't want to share that. Maybe you feel my partner will go with someone else. So you don't want to declare. But this is also your body part. Don't you think so? As compared to your neck, your constipation, your flu, your fever, this is also your body part. And you have to take care of it. And for that you have to go to the specialized person where you are going to seeking a help. Isn't it?
Sure.
So why we are feeling shame? Why we have to feel shame? It is not like something artificial you have brought it and you have implanted in your body. Is it like that?
No.
So please from today stop doing that, stop behaving that. We go for any other problem, our body problem, we go to the doctors and we don't feel any shame. Isn't it? Person can go, oh doctor, I am suffering like since 6-8 years constipation. Do you feel shame? It is a shameful. You are suffering since 8 years constipation. You are not able to you are not able to pass the regular bowel syndrome. Is it not a shameful?
It is.
You are not feeling shame. Why? Because that is mentally. That is our mental. So please overcome of this situation. These are also very important, in fact, body part of yours, which you have to take care. Again and again, you have to talk to your partner, you have to talk to your seeking help wherever you want, and you have to come to the conclusion. You have to talk about it. Yeah. So thank you very much. This is Dr. Neha Bhatt. My contact number is 0737809000. On Facebook, you can always find me on N Health and Wellness Center. On YouTube, it is Yadav Neha Bhatt. And any kind of problem you are suffering with, any kind of health issue, you can always contact me. I am doing all the drugless therapies. I don't involve any medicine. So you can always contact me on my WhatsApp, or you can always direct call me. I'm just available here in Thika. So yeah, that's the thing. Thank you.
Thank you so much, Doc, for enlightening us and telling us that we should not be ashamed and afraid to talk about the issues we have. Ladies and gentlemen, we hope that you have been able to learn a thing or two from this episode, and that we will help you overcome these issues, and they are not shameful, they are part of us. Remember, choose to love, choose to be kind, choose to be happy. My name is Juliet Modhoni. You are watching 3T TV. Until next time, take care.